Okay, guys, so we're just continuing on. This is part 2 of the Integumentary system, which is chapter 5 in your medical terminology book. So now we're looking at Kaposi sarcoma. Okay, so this is a rare malignant meaning cancerous, right, lesion. They begin as a soft purple-brown nodule or plaque on the feet. It gradually spreads throughout the skin, and there's an increased incidence in men with AIDS. And then we have a keloid. So this is an enlarged, irregularly shaped, elevated scar that forms due to the presence of large amounts of collagen during formation of a scar. So sometimes the simplest example I can give for a keloid is if you've ever had your ears pierced, right? And sometimes you get like these little, like a little ball, right? It feels like a little like pea-sized ball or something like that where you had your ear pierced. That's considered a keloid. That just means whenever something happened that a bunch of collagen went to that area, and it's causing that little area to scar more outward than inward, if that makes any sense. Then we have keratosis. So this is a skin condition in which there is a thickening and an overgrowth of the cornified epithelium. So if anybody's ever seen corns on somebody's feet, that's kind of the same thing. And then we have seborrheic keratosis. This is a brown or waxy yellow wart-like lesion that's loosely attached to the skin surface, and is also known as a seborrheic wart. And then we have actinic keratosis. So this is a pre-malignant, so not quite cancerous, but it's kind of on its way there, right? Gray or red to brown hardened lesion. It's caused by an excessive exposure to sunlight. Again, wear your sunscreen, right? And it's also known as a solar keratosis. And then we have leukoplakia. This is a white, hard, thickened patch. It's firmly attached to the mucous membrane, such as the mouth, the vulva, or the penis. Okay. So question, true or false? Keratosis literally means the condition of a horny-like growth in the upper layer of skin, like a wart or a callus. True or false? That is true. So this originates in the stratum corneum, which is the uppermost layers of cells with no nuclei and a plate-like appearance. Okay. And then we have malignant melanoma. So this is a malignant cancerous skin tumor originating from melanocytes in pre-existing nevi, freckles, or skin with pigment. They're usually darkly pigmented tumors with irregular surfaces and borders, and usually varies in color. It can be kind of dark red, dark brown, black, blue, those types of colors. So there's what's called the ABC of a malignant melanoma. So what you're looking for is asymmetry. So if you were to take that tumor or that little mole or whatever it is and slice it right down the middle and fold it in half, would the two halves match? Would they be symmetrical, right? So asymmetry means that they're not, right? So if somebody has a spot or a wart or a mole that they're looking at and they're thinking, oh gosh, that doesn't look normal, right? That's one of the things that people look for is it asymmetrical, meaning that it doesn't have symmetry to it. The borders are usually kind of out of whack, right? So one side might be a little bit smoother where some are kind of out of whack. The color of it, and then the diameter. So what you're looking for is the diameter is the size of the mole, and if it's growing rapidly. And then we have Nevus or Nevus, which is the visual accumulation of melanocytes, creating a flat or raised rounded macule or papule with definite borders, and this is also known as a mole. So question, based on the definition of melanoma, what is the actual meaning of melanin or melon? What do you guys think? That would be A. Good. So melanocytes is a cell that produces the dark pigment, in our skin, hair, and eyes. So albinism is the absence of this pigment. Okay, so then we have Let me see. I can't look at it. Onychocryptosis. So this is an ingrown toenail, or ingrown nail, I guess, not necessarily just on your toes, but it's most commonly seen on toes, and usually the large toe. If you've ever had one, bless your heart, because they hurt. And then we have Onychomycosis, which is a fungal infection of the nails. And then we have pediculosis, which is a highly contagious parasitic infestation caused by blood-sucking lice. Woo! I don't like lice. Yep. So, yuck. Okay. So pediculosis capitis is lice that's found on the head. Pediculosis corporis is found on the body. Pediculosis palpebrarum is on the eyelashes and eyelids, and then pediculosis pubis is lice in the pubic hair. Fun, huh? All right, so then we have Pemphigus, which is a rare incurable disorder. It's manifested by blisters in the mouth and on the skin, and it spreads to involve large areas of the body. And then we have a pilonidal cyst. So this is a closed sac located in the sacrogageal area of the back, which is kind of towards the bottom part of your back, and it's sometimes noted at birth as a dimple. Then we have psoriasis. This is a common non-infectious chronic skin disorder manifested by silvery white scales over round raised reddened plaques producing itching. Sunlight is really good for psoriasis. So that's kind of what psoriasis looks. So you have kind of this raised area, right? But then it has like these silvery little flakes or plaques on top of them. And then we have rosacea. So this is a chronic inflammatory skin disease that mainly affects the skin of the middle third of the face. So usually like around your cheeks and your nose. It's characterized by persistent redness over areas of the face, nose, and cheeks. Then we have scabies. This is a highly contagious parasitic infestation caused by something called a human itch mite. It results usually in a rash, slightly raised thread-like skin lines. So scabies is something that you need to seek medical attention for. There's scleroderma. So this is a gradual thickening of the dermis and swelling of the hands and feet to a state in which the skin is anchored to the underlying tissue, and there's no cure for that. Then we have systemic lupus. So this is a chronic multi-system inflammatory disease. It's characterized by lesions of the nervous system and skin, renal problems, which is kidney problems, and vasculitis. And it's characterized or has a characteristic butterfly rash that's usually seen on the nose and face of somebody that has it. And then we have tinea, which is a chronic fungal infection of the skin. It's characterized by scaling, itching, and sometimes painful lesions, and it's commonly known as ringworm. And again, there's different parts that you can get it in, right? So the scalp, the body, the groin, and maybe even your foot. Foot would be considered like almost like athlete's foot, right? And then we have Verruca. Anybody watch Charlie and the Chocolate Factory? Her name is Verruca Salt, right? It's because she's a little brat. No, I'm just kidding. So this is a benign, circumscribed, elevated skin lesion that results from hypertrophy of the epidermis, commonly known as a wart, and it is caused by the human papillomavirus. So we have Verruca vulgaris, which is a common wart on the face, elbow, fingers, or hands. And then we have plantar warts, which are either like a single wart or a little cluster of warts found on the bottom or the sole of the foot. Then we have venereal warts, which are transmitted by sexual contact. And then we have seborrheic warts, which are seen in the elderly on the face, neck, chest, or upper back. And these are usually benign, meaning not cancerous. So question, what condition is described as a highly contagious parasitic disease caused by a mite? Anybody remember? That would be C. The little mite burrows under the skin to lay eggs. Blech. Anybody itchy yet? All right, so now we have diagnostic techniques, treatments, and procedures that have to do with the integumentary system, which is our skin, right? So, diagnostic techniques, treatments, and procedures. The first of those is going to be something called an allergy test. So, this is when various procedures are used to identify specific allergens, so something that you might be allergic to. And it's done by exposing the individual or the person to a very small amount of that allergen. So let's see, this immunocap allergy blood test is a more advanced, convenient, and reliable way to figure out that allergy. But then there's actually the intradermal patch and scratch test that's common. So what they do is they do what I've seen scratch tests. I've had scratch tests done, but is they like either on your arm or your back or something like that, they'll kind of do a grid and go through and like scratch your skin and put in a little bit of that allergen to see what you are allergic to. Cautery or cauterizing something is whenever heat burns and scars the skin. Sometimes they have to cauterize like bleeding veins or vessels or things like that, but they can also do the same thing with skin. So if somebody has like a skin cancer or something, they can cauterize it to get it off, and hopefully it'll be gone. Cryosurgery, this is a non-invasive treatment that uses sub-freezing temperatures to freeze and destroy tissue. Then we have curettage and electrodesiccation. So this is a scraping away of abnormal tissues, followed by destroying the tumor base with a low voltage of an electrode. And then we have debridement. So this is whenever we remove debris or foreign objects and damaged or necrotic tissue or skin from a wound to prevent infection and promote healing. Then we have dermabrasion. This is the removal of the epidermis and a portion of the dermis with sandpaper or brushes to eliminate the superficial scars of unwanted tattoos. Then we have dermoplasty. This is a skin transplantation to the body surface damaged by injury or disease, so like a skin graft, right? And then we have electrodesiccation, which is a technique using an electrical spark to burn and destroy tissue, and it's also known as fulguration. Then we have electrosurgery. So this is the removal or destruction of tissue with an electrical current. And then we have askerotomy. Askerotomy? Sure. So this is an incision made into the necrotic tissue, so dead tissue, right? Resulting from a severe burn. We have liposuction. So this is whenever we aspirate fat through a suction cannula or a curette to alter the body's contours. Skin biopsy. This is a removal of a small piece of tissue from a skin lesion. It's usually examined under a microscope, and it's used to confirm or establish a diagnosis of some sort. And then a skin graft, this is the process of placing tissue on a recipient site. It's sometimes taken from a donor site in order to provide the protective mechanisms of skin to an area that may not be able to regenerate skin. A lot of times these days sometimes they're using like fish skin. I know it sounds really weird, but Google it. It's kind of cool. And then we have a Woods lamp. This is an ultraviolet light that is used to examine the scalp and skin for the purpose of observing fungal spores. So true or false? Dermabrasion removes debris or necrotic tissue and assists in wound healing. What do you guys think? That would be false. So debridement is what that is. It helps to take away any debris or foreign objects or damaged tissue, damaged skin, so that the skin can continue to heal. And that's it. Okay, sounds good. So there's 3 different assignments attached to this one. So hope everybody's good. Talk to you guys later.